Hey guys, Justin Smith here from Hunter Podiatry Services, and I'm here to give you my top tip of the week. Today I want to talk to you about a clinical concept or a framework of thinking that I'm usually using with my patients, and I want to share that with you today to help get you results with your injury rehab or just understanding a little bit better. So have you ever noticed that when there's a complex injury or a chronic persisting pain, it can be very overwhelming and frustrating and can be quite tricky to put our hand on exactly what's happening. Especially the longer that goes, the more frustrating and overwhelming it becomes. One very simple framework for thinking that I'm discussing and introducing to people very quickly is the concept of what, why, and how, which is very similar to a famous book, Start With Why, and Simon Sinek, where he talks about why, how, what. So I want to break that down and how that translates into looking at our injury or rehab. And firstly, starting with what? Well, that's the phase of, well, what are we actually dealing with? What tissues are involved? What is the specific injury or pathology, and to what level? Why? That's starting to unpack and figure out what are the contributing factors for you that have led us to this point of the pathological threshold, or the point where we start to develop symptoms or an issue. So why is it there? We figure out all those factors. And then how? So how are we going to get that better? How are we going to plan out the treatment pathway over the next little while? Just providing a bit of structure and a bit of framework is a very simple thing to try to organize amongst the chaos when we're dealing with persistent injury. So that's a very common one that I'm sharing with patients and when we're faced in the clinic with complex things that we're often seeing all the time. So I just wanted to introduce that to you today. Start thinking about our injuries with a bit of a framework, and have the best weekend. Cheers guys.